So Clinica has several outfits set up to aid our homeless population. One of which is our medical clinic here on Baker Street. It's strategically put in sort of the heart of one of the larger homeless populations. We do have 2 shelters very, very nearby here. So we are actually able to provide all primary medical care services at this clinic here. And then down the street, I would say about a half mile, we have Old Town Kern. And they provide all of our social services, such as getting people into housing, getting appropriate documentations, licenses, social security cards, things of those nature. And they also provide substance use counseling on site down on Baker Street. We have a very similar service in Fresno to the Old Town Kern, which is the resource center. And again, they have a team there that's set up to help our homeless population find housing and get all the appropriate documentation. They also have substance use counseling available there. You sort of have to take this population and treat it as a very special population. There's a lot of distrust in the population of the medical system as a whole, as systems as a whole. There's a lot of distrust. And in this population, unfortunately, there's also a lot of underlying severe chronic illness, a lot of severe medical, as well as psychosocial issues. So I think it has to be treated with a certain level of diligence and understanding that's a little bit different from your normal population. That being said, I think Clinica's done a really good job of providing those services with clinics such as this, with our street medicine outreach efforts that we do every Thursday. We noticed a need for on-site, boots on the ground medical services in a lot of the encampments here locally. Those patients were not having any sort of interactions with healthcare. So we decided we would actually go to them where they are. We've been very successful. We've been able to treat a lot of chronic medical conditions. We've been doing on-site procedures. Those relationships have been among some of the deepest and some of the best of all my patients I've had. I think there's a level of appreciation that is pretty unmatched. So it's been an amazing effort, and we're actually expanding, hopefully within the next few months, expanding our second street medicine team. I hope that anyone who finds himself or knows someone living in an unsheltered state is aware that Clinica cares about those patients as much as we care about every one of our patients. We have robust services in place for them, including medical services, social services, street outreach services. So if you know of anyone or someone who's suffering from this, just reach out to us. We are happy to accommodate you in any way we can. And for the community at large, I think it's important for all of us to understand that what we're talking about are our neighbors, our loved ones who are suffering. This is the true definition of suffering. And I would hope that, we can all find a little place of empathy and sympathy in our hearts and treat this population like we would treat everyone else.